You are sitting in your car in the parking lot of your doctor's office. You just got a phone call. The nurse read you a number, and right now, your hands are still on the steering wheel, but your mind is somewhere else entirely. Exhales sharply. That number was your PSA, and it was high. Pause. Here is what nobody tells you in that moment. That number alone does not tell you what is happening inside your body. It does not tell you whether you are in danger, and it almost certainly does not mean what you fear it means. More than 3 million men in the United States are living right now with elevated PSA levels. Most of them were never given a clear explanation of what that number actually means, or more importantly, what it does not mean. Today, that changes. Determined. My name is Dr. Daniel Carter, and I have spent decades in urology and men's health, working specifically with patients navigating prostate concerns. If you are a man over 50 who just received an elevated PSA result, or if you love someone who has, this video was made for you, because this information could literally change the course of what happens next. Here is what most men are never told about the PSA test. PSA, prostate-specific antigen, is a protein your prostate has been producing your entire adult life. It is not a cancer marker. It is an activity marker. It tells us the prostate is doing something. It does not tell us what. Think of your prostate like a factory. When the factory is running smoothly, PSA leaks into the bloodstream at low, predictable levels. But when something disrupts the factory, growth, inflammation, pressure, or disease, that leak gets bigger. The alarm goes off. A high PSA is the alarm. It is not the fire. Here is the problem. The American Urological Association has confirmed that PSA elevation is one of the most frequently misinterpreted lab results in routine medicine. Men are given a number and sent home to Google it. What they find terrifies them. What they don't find is the complete picture. Today, I am going to walk you through the 5 most important things that can raise your PSA. Things your doctor may have mentioned briefly, but probably never fully explained. And after each one, I am going to tell you exactly what to do about it. Because once you understand what is actually happening inside your body, the fear begins to lift, and that is where real decisions get made. Number 5. The silent enlargement nobody warned you about. Most men over 50 have this. Almost none of them know it is affecting their test results. It is called benign prostatic hyperplasia, BPH, non-cancerous prostate enlargement. Your prostate is supposed to be roughly the size of a walnut. After 50, it often grows to the size of a lemon. After 60 or 70, sometimes larger. Here is what that does to your PSA. The bigger the prostate, the more cells it contains. More cells means more PSA produced. More PSA produced means more PSA in your bloodstream. Your number goes up, not because something is wrong, but because the organ is simply larger. A landmark study published in the Journal of Urology found that men with significant BPH can have PSA levels 2 to 3 times higher than men with normal prostate size, with no cancer present whatsoever. I had a patient, 63 years old, retired engineer, who came in convinced he had cancer after his PSA came back at 7.8. He had been losing sleep for 2 weeks. When we measured his prostate, it was nearly 3 times the normal size. His PSA was elevated because his prostate was large, not diseased. He left my office that day with a completely different understanding of his body. The fix is this: ask your doctor to calculate your PSA density, that is your PSA level divided by the size of your prostate. A PSA density below 0.15 is generally reassuring. This single calculation can completely reframe what your number means. And here is the detail almost nobody mentions. Most men are never told PSA density exists. It is one of the most useful tools in prostate evaluation, and almost nobody asks for it. Have you ever had your prostate size measured alongside your PSA? Drop yes or no in the comments right now. Number 4. The inflammation that looks like cancer on paper. This one surprises almost every man I tell it to. Prostatitis, inflammation of the prostate, is extraordinarily common. It affects nearly 50% of men at some point in their lives, and it can send your PSA through the roof. Here is what happens inside your body. When the prostate becomes inflamed, from infection, from irritation, from bacterial exposure, the tissue barrier between the prostate gland and the bloodstream breaks down temporarily. PSA floods into the blood at a rate far beyond what normal gland activity would produce. Numbers that might sit at 3 or 4 under normal conditions can jump to 8, 10, even 12 in a matter of days. A major study published in Urology found that acute prostatitis can elevate PSA by up to 400%. 400. And here's the part that matters. Once the inflammation resolves, the number comes back down. A 71-year-old patient of mine came in after his primary care doctor called him urgently about a PSA of 11.4. He was told to prepare for the possibility of a biopsy. When I reviewed his history, he had been treated for a urinary tract infection just 3 weeks earlier. We waited 6 weeks, retested. His PSA was 4.1. No biopsy was ever needed. The fix. If your PSA result is new and elevated, ask your doctor whether recent infection, urinary symptoms, or prostate inflammation could be a factor. In many cases, a waiting period of 4 to 6 weeks followed by a repeat test tells the real story. And here is what most people get wrong. Even a recent prostate exam or catheterization in the days before your blood draw can temporarily spike your PSA. Timing matters more than most patients are ever told. Number 3, the daily habit that quietly pushes your numbers up. You probably did this yesterday. You will likely do it again tomorrow. And it has a measurable effect on your PSA that most men are completely unaware of. Prolonged pressure on the perineum, the region between the legs that sits directly against the prostate, can temporarily elevate PSA. This includes long hours of cycling, prolonged sitting on hard surfaces, and certain physical activities that compress the pelvic floor. Here is what is happening inside your body. Physical pressure against the prostate gland causes microtrauma to the tissue. The gland responds by releasing slightly elevated amounts of PSA into the bloodstream as part of its normal protective response. It is not dangerous, but it can be misleading on a lab report. Research published in the British Journal of Urology found that men who cycled for more than 30 minutes before a PSA blood draw showed measurably higher results than men who rested. In some cases, results were elevated enough to prompt unnecessary further testing. I sat across from a 68-year-old man who had been an avid cyclist his entire life. He came to me after 3 consecutive elevated PSA readings. We asked him to rest completely for 48 hours before his next draw. His PSA dropped by nearly a full point. He had been inadvertently inflating his own results for years without knowing it. The fix. Before your next PSA blood draw, avoid cycling, horseback riding, and prolonged sitting on hard seats for at least 48 hours. This is a free, simple adjustment that can meaningfully change your result. And here is the pro tip. Most lab requisition forms do not ask about recent physical activity. Your doctor may not think to ask. You need to raise this yourself. Number 2. The PSA trend that changes everything. This is the piece of information that most men sitting with an elevated PSA result are never shown, and it is arguably the most important one. A single PSA number on its own tells you very little. What tells you everything is the trend, how that number has moved over time. Here is what that means inside your body. The prostate, as it ages, naturally produces more PSA at a gradual, predictable rate. A slow, steady rise over years is often consistent with normal aging or benign enlargement. But a rapid, accelerating rise, what doctors call high PSA velocity, is a different signal entirely. That pattern asks for attention. A randomized study published in the New England Journal of Medicine found that PSA velocity greater than 0.75 nanograms per milliliter per year was associated with a significantly higher likelihood of clinically significant prostate cancer. The speed of the rise mattered more than the absolute number. A patient I will call Thomas, 66, healthy, active, came in with a PSA of 6.8. Taken alone, that number might have led to a conservative wait-and-watch approach. But when we pulled his records, we found his PSA had been 3.2 just 18 months earlier. That rapid doubling in a short window told a different story. We moved forward with imaging. We found something that warranted attention, and we caught it early. The fix. Ask your doctor to pull every PSA result you have had in the last 5 to 10 years and map the trajectory. If you have never had one before, that is your baseline, and every subsequent test becomes more valuable because of it. And the detail most people miss. Some patients have their records scattered across multiple providers. Request a copy of all past labs and keep them in a single personal health file. That record could one day be the most important document you own. Stop right now and ask yourself honestly, do you know what your PSA was 2 years ago? 3 years ago? Most men over 50 do not. Write, "I'm checking" in the comments if this is something you are going to do today. Number 1. The biopsy decision most men are never fully prepared for. This is where the real danger begins, not in the PSA number itself, but in what happens after it. Many men with elevated PSA results are moved toward biopsy before they have exhausted far less invasive options that modern medicine now provides. A biopsy is sometimes necessary. It is not always the first logical step. And the difference between knowing that and not knowing it could change what you agree to. Here is what happens inside your body during a prostate biopsy. A needle is guided into the prostate, typically 12 or more times, to extract tissue samples. It carries real, if low, risks: bleeding, infection, urinary disruption, and occasionally more serious complications. And here is what most men are not told before they agree to one. A prostate MRI performed first can dramatically improve the precision of that biopsy, or in some cases, eliminate the immediate need for one entirely. A landmark study published in The Lancet found that MRI-targeted biopsy detected 30% more clinically significant cancers than standard biopsy, while detecting 50% fewer insignificant ones. Men who skipped straight to standard biopsy were more likely to be biopsied unnecessarily and less likely to find what truly mattered. A 62-year-old man I treated had been told by a previous provider that given his PSA of 9, a biopsy was the appropriate next step. He came to me for a second opinion. We ordered a multi-parametric MRI first. His prostate was enlarged and showed no suspicious lesions. We placed him on active surveillance with repeat testing every 6 months. 2 years later, he has never needed a biopsy. He is fine. The fix. Before agreeing to a biopsy, ask your doctor whether a multi-parametric prostate MRI is appropriate in your case. Ask whether additional blood markers, such as the 4K score or prostate health index, have been considered. These tools exist precisely to help avoid unnecessary procedures. You have the right to ask for them. And here's the phrase to use with your doctor. Say, "I would like to consider non-invasive testing before proceeding to biopsy." That single sentence can change the entire conversation. Here is your complete protocol for what to do after a high PSA result. You can start this today, not next month. Today. Step 1. Before your follow-up appointment, gather every PSA result you have ever had. Call past providers if needed. Create a timeline. Step 2. At your appointment, ask your doctor to calculate your PSA density using prostate size measurement. If prostate size has not been measured, request it. Step 3. Ask about velocity. Request a PSA velocity calculation based on your historical trend. Less than 0.75 nanograms per milliliter per year is generally low concern. Higher than that warrants closer attention. Step 4. Ask about a repeat test if you have had recent illness, infection, or physical activity. Wait 4 to 6 weeks if any of those factors were present. Retest under clean conditions. Step 5. If imaging or biopsy is recommended, ask specifically about multi-parametric MRI before proceeding. Ask whether secondary blood markers like the 4K score have been considered. Step 6. Follow up every 6 to 12 months with a consistent provider who has access to your full history. Research published in the European Urology Journal found that men who followed a structured step-by-step PSA evaluation protocol reduced unnecessary biopsies by up to 43%, with no increase in missed significant cancers. This works, the science is solid, and you can begin it today. Let us bring this together. Number 5. Benign prostate enlargement, silently inflating your PSA for years. Number 4. Prostatitis, a temporary inflammation that looks alarming on paper. Number 3. Physical pressure and daily habits, pushing your numbers up before you even walk into the lab. Number 2. PSA velocity, the trend that carries far more meaning than the single number. And number 1, the biopsy decision, moving too fast before the full picture is clear. Each of these alone can distort what a PSA result seems to mean. Together, they create a perfect storm of misunderstanding that sends men spiraling into fear before a single informed decision has been made. This is not fate. This is not inevitable. This is preventable. A high PSA is a signal worth taking seriously. It is not a verdict worth losing sleep over before the evidence is complete. Your prostate has been working inside your body for decades, without complaint, without recognition, quietly doing its job while you lived your life. It deserves to be understood, not feared. Tonight, pull up your last lab report. Look at that PSA number. And instead of reading it as a verdict, read it as the beginning of a conversation. A conversation you now have the tools to have. You are not a passive victim of a lab result. You are an informed man who knows what questions to ask, and that changes everything. If this video gave you something useful, please hit like. It helps this reach another man sitting in his car right now, holding a lab report he does not fully understand yet. Subscribe, because every week I share clear, clinical health information built specifically for men over 50, the kind of information you should have received in your doctor's office but probably did not. Type, "I'm taking the next step" in the comments below. Writing it down makes it 3 times more likely you will actually follow through. And that is not a motivational phrase, that is behavioral science. And share this with your father, your brother, your husband, your partner. You may never know whose life you protect by doing that, but it matters. It always matters. I am Dr. Daniel Carter, and I will see you in the next video.